The mental illnesses that I can name are schizophrenia, depression. I don't know what you call it when somebody's feeling suicidal. Is it masochism? Like, self-harming? I don't know, pathological aggression, when kleptomania, triskaidekaphobia, fear of the number 13. I don't know, any other phobias, and all the other phobias.
Can I name any mental illnesses that I know? I know none, honestly.
These are the mental illnesses I know. I've heard of bipolar, I've heard of schizophrenia. I hope I pronounced that correctly. And then I think that's it.
The mental illnesses that I know are depression. I don't even know how to term them though.
I know someone with attention deficit disorder, and I know someone with a form of schizophrenia, and I knew someone who had mental illnesses from syphilis. Yeah.
What is considered a mental illness though?
The common mental illnesses that people know are depression, schizophrenia, and bipolar disorder. The extent to which the symptoms and treatment for these common illnesses are known varies. What about the other mental illnesses? Do people have enough information about those? Perhaps the first question should be, what illnesses are we talking about? My name is Peter Nawa, and you are listening to Silence Interrupted. According to the National Alliance on Mental Illness, a mental illness is a condition that affects a person's thinking, feeling, or mood. Such conditions may affect someone's ability to relate to others and function each day. If this is the definition of mental illness, are there mental illnesses that are prevalent in Zambia? And if so, what are they? I spoke with Dr. Maria Akani, who is a psychiatrist, clinical psychologist, and managing consultant at Renaisense, to shed more light on the different types of mental illnesses, as well as our perceptions on seeking help for these illnesses. Also, I wanted her to give me some clarity on what we really mean when we refer to mental illness and mental health. So what are some of the mental illnesses and conditions that you have noticed?
We have a number. The common ones that you see in admission, obviously having had experience at Chainama Hospital, the common ones you see in admission, for example, among female patients is depression, and among male patients is substance abuse, substance and drug, and also schizophrenia. So the schizophrenia spectrum of disorders is also common among males more than females, even though they both present in both sexes, and also bipolar disorder, which is a type of mood disorder. And then we also have a number of neuropsychiatric disorders like dementia and syndromes that are related to other organic brain diseases, for example, those that may result from epilepsy or people who've had injury to the brain because of infection like HIV or syphilis, or even due to stroke or head injury and so on. Then we also have the ones that are common in children, which may have to do with like attention deficit hyperactive disorders or autism and so on. Those do not get treated at Chainama primarily because Chainama does not focus on children. But maybe those ones are seen more at UTH, University Teaching Hospital, and in private clinics.
Why should we be concerned about mental health?
Well, first of all, one of the things that I always say is that when you think about what makes a person, it's really their mind. So if you have your limb chopped off, you can still be Peter. But if your mind is not all right, you will not be Peter anymore. And your mind determines your options, your choices, your ability to show restraint or preference, And if your mental health is not all right, then really you're threatening the integrity of the person that you are. And mental health, sound mental health, precedes functionality at all levels. So whether we think of somebody who sells at the market tomatoes, or we think of an executive director, you still need sound mental health to function. Sound mental health also precedes a meaningful social life, family life. So for you to be a good parent and for you to make meaningful contributions in the community, you need sound mental health. Whereas with other conditions, yes, they will affect obviously your functionality because they will require some time and some attention, but sometimes you can find a way around them and still live a very meaningful life.
Would you have an idea of how serious mental health is, or mental illness? Am I, first of all, using the right word? Am I using the right word? Mental illness or mental health, is it the same thing?
So mental health is the absence of disease. Mental illness is the presence of disease. But somewhere in between, there is also something going on there. And so just because somebody does not have a diagnosed mental illness doesn't necessarily mean that their mind is in a healthy state. And that's what I mean when I say there are some things in between there. Because a person who has profound stress, unresolved grief, is going through different kinds of pressures, psychological pressures, may not necessarily be diagnosed with an illness like depression, but their mind may not be at a point where they can be considered healthy, and as such they may require different kinds of interventions as well. And that is the reason why when you talk about why we should be concerned about mental health, that's why, because it can be anybody really. Yes, it's true some illnesses run in families, but some of them, it's not a matter of families. You could be involved in a car accident and end up with post-traumatic depression. And you could end up with different things that would then affect your functionality, and you will need support. You could have maybe gone to a war zone and come back with post-traumatic stress disorder. Sometimes you don't even have to go to a war zone. You just need thugs to come to your house, and that's enough to give you trauma. Yes, so others have ended up with addiction problems, which they never thought they would, because now they've gotten into this habit with friends initially, but now they've gotten to that stage and they need help.
So would you have an idea of the gravity of the situation in Zambia, or how serious it is?
Unfortunately not. We don't have any statistics for the country, but worldwide statistics seem to suggest that at least 1 in 5 people have some kind of a mental health problem that requires intervention.
I did an online search and found a Zambia Daily Mail article titled Living with Mental Illness. It stated 20 to 30% of Zambia's population has a mental health problem. However, they did not state where these figures were coming from. The Zambia 2010 census estimated that 6.8% of the population had a mental illness. At the time, Zambia's population stood at 13 million. In 2018, the population is estimated at 17 million. The census, however, did not break down the types of illnesses. I did find out that the Zambia National Disability Survey done in 2015 did take a more detailed survey on mental health, which included looking at the specific illnesses. At the time of this recording, the report had not yet been released. I guess if we want to get a sense of the types of illnesses people are treated for, we would have to go to individual health institutions. When it comes to official nationwide statistics, some do exist, but are not comprehensive enough. However, going by global statistics from the World Health Organization, according to 2017 figures, the estimates are that 300 million people are affected by depression. 60 million people have bipolar disorder, 21 million suffer with schizophrenia, and 47.5 million people have dementia.
Maybe maybe the profile of mental disorders is a bit different, for example, in Western countries as opposed to third world countries, but still there's quite a big presence of illnesses, depending on whether you have more poverty or not, and every situation comes with its own challenges.
Is there some kind of rule of thumb if I wanted to make an assessment whether a friend or a family member has a mental illness that maybe needs to be looked at? Or what are the telltale signs that I should be looking out for to either say maybe it's time to get help, or it's not something that is serious and it will probably phase away?
So the rule of thumb obviously will be a bit difficult for the layperson, but I will just explain some things that may be helpful. If a person is having problems in more than one aspect of their life, so for example, you have a problem at work and you're failing to work, maybe anger problems at work, but they're also showing up at home and they're also showing up in your recreational life. So they're showing up in more than one dimension of your life. So it's not just your occupational life, but maybe your social life as well, or your recreational life. Then there's definitely a problem. And then the second thing is there should be a change in functionality from the previous one to the present one. So a clear distinction. So there's those people who generally just have personality problems, and then there's those who have clearly decompensated, like they were not like this before, and then there's a clear distinction. Then you can be able to say, I think there's something wrong requiring intervention.
And is there a duration, or it can just be somebody just changes for a week? Would that be cause to concern, or do I need to look at a sustained period?
It depends on what it is. If we're talking about things to do with depression, for example, because they take a bit longer sometime, you would want to say 4 weeks or so. But if you're talking about things like bipolar, and when we talk about bipolar, we're talking about manic episodes, and this is the hyperactive state. Even 1 week is adequate because they can be very dangerous. People are involved in high-risk behavior, and they may sleep around, they may drink a lot, they may spend to detrimental levels and even get into debt. They may sell their house in the process, so you don't want to wait too long, obviously. But if you can have maybe an average of like 2 weeks, then you know, okay, this thing requires intervention.
You've talked about bipolar, and I think it's one mental health issue, mental illness that most people do not know much about. Most commonly, they know depression. They may know a bit of schizophrenia, but whether they know it as schizophrenia is another thing. Would you mind talking about bipolar and what it entails or what it is?
Okay, so bipolar is a mood disorder, and it's called bipolar because it has two poles. So bi for two and polar for poles. So it basically has the high pole and the low pole. And the high pole is called mania, or the hyper state. And the low pole, which is when the person has the low mood, is the depressive state. So the person typically swings between having a very high mood and a low mood. It's very rare that they have both of them at the same time, in terms of yesterday they were hyper and tomorrow they're depressed. But usually the person would be maybe hyper for like 1 week, and they're talking continuously. They have these amazing ideas, and these ideas border on things which can be unrealistic in the person's circumstances, but they're very happy, overly cheerful, and overly familiar. They meet you today like you've known each other for years. They're very open about their lives and ready to get rid of any boundaries. So that means that usually they'll be easily involved in sexual activity and so on. And some of the things also are to do with spending, so they can give away generously, give their things. And they also like to dress in very bright colors. They seek attention. You cannot miss somebody who's bipolar. And then when they're in their depressive state, it's like a total opposite. So this is a person who is not optimistic about life at all. They feel guilty. And so in bipolar, they're feeling very important. Okay. And then in depression, they're suddenly feeling like they're not important. They're better off dead. They feel guilty. They would rather die. They have no contribution whatsoever in life. They have poor self-care. So they're not dressing up, not bathing, not eating, maybe not sleeping, and so on. So you have like the opposite state.
And those swings can happen within a period of a week? Or is it?
Typically, a person can have, what usually happens is that a person will start with depression. So you will see a person who has problems and they're getting depressed, and then all of a sudden, maybe after 2-3 weeks of depression, then they get into this hyper state, and they can be in that state for a week, 2, even more. And if they're untreated, they can even stay in that state for 4 to 9 months. Yeah, and the dangerous part about it is that the person actually gets exhausted because they can do a lot of things. Like they have the strength of Hercules or something. So they can stay up all night for days and they do amazing things, which, and the hard part is that they can't focus on any task. So they will start this task and then they can't complete it. They will start cleaning the house halfway done and then they can't complete and get onto another project and so on and so forth.
Okay. What have been the misconceptions that you've encountered about mental illness in Zambia?
The first one is to think that they have mental illnesses and we do not. I think that's one misconception I find a lot. And every time people ask me, so you're a psychiatrist, so you see loony people. And I say, I see people just like you. And if you were to live in my world, you would see that, there are regular people with regular lives, and they are people who never thought they would end up in those situations. Maybe some of them did, but others never thought those things would happen to them. And that can be a very, very scary place. So that's one. The second one is to assume that once a person has been diagnosed with a mental illness, they can never, ever recover or never make a meaningful contribution in life. That also is a misconception I have encountered. And you find that every time you have diagnosed someone with a mental illness, you have to sit with them and their family and counsel them that this is not it. And this person can still live a functional, meaningful life in society and make a contribution. That's the second one. I guess the third one is just the idea that people with mental illnesses are violent and want to harm you. It's a scary place to be, especially if a person has altered perception of reality. You're hearing voices and nobody else can hear them. You're wondering whether people are just making up things and trying to make you sound crazy or it's really happening. And that can be a very scary place to be. So obviously they need a lot of support. But I think the misconception is that, when somebody has gotten to that state, that they're violent and they can attack you and that they're dangerous. So I think those are some of the three that I can think about off the top of my head.
Okay. So, and I think the major issue with mental illness, perhaps in society in Zambia, is what people see outwardly. Those are people in the streets who are either naked or going through garbage and so forth. Would you have an idea what those people are probably ill with, or what occasionally it is, or is it different? It could be multiple illnesses.
There was a study done in Zambia over 10 years ago. I wish I could cite it exactly, but there was a study done and it was investigating the people on the streets. And it was found that a number of them actually did not have diagnosable mental health conditions. They were just homeless or destitute, so to speak. So there were quite a considerable amount that just had nowhere to stay or things like that. But obviously they also had some mental health challenges because you can't live in a place like that and be the best version of yourself. But I think one of the common things that has been found about people who are on the streets or who end up on the streets are people with conditions like schizophrenia, because most of the times their thoughts may be fragmented and they can't make sense of a lot of things. And they're typically people who have been abandoned by their families. So families have either given up on them, and I don't judge all the families for doing. I mean, of course, I know a number of them could do with a bit more patience, but some of them can be very difficult because maybe they have not responded to treatment, and there are other challenges. You find that it's an older brother and your parents are dead. You have your own family you're trying to look after, and your older brother is going through this stage. You can only look for him so many times when he goes wandering and so on. So there are things like that. But yeah, so a number of them have got schizophrenia. So in schizophrenia, a person does not it's a disease that deals with abnormal thoughts and feelings, and also reality perception. So they may not, like, the logical sense starts disintegrating, and the ability to feel, instead of somebody maybe feeling happy about things, bad news, they may instead not feel anything at all, and so on. So those things can cause somebody, because they can't function. So those things can make somebody end up on the streets after, obviously, they're abandoned. But so can people with severe depression who have not been supported, because they have a poor sense of self-care and hopelessness, and the motivation is gone. So motivation keeps you trying to self-care. And if you don't have that, you can't care for yourself very well.
So essentially, they are not a hopeless case. They can be diagnosed, helped, brought back into society?
Yes. Well, I don't know if you can ever say anyone is a hopeless case. Definitely, that's not something that can come from me, because I really believe in people being able to change and help being available for people. So I can't say hopeless case about anybody. But I can say that for some, they might be helped with limitations. So remember, I talked about some who have maybe poor response to treatment. And then also, if a person has got schizophrenia, or even depression, or any condition, and has not been treated for a very long time, there's some irreversible changes that take place. Just like if you have malaria, if you're treated on time, you have a 3-day treatment and that's it. But if you're not treated on time, Coartem won't work. You need quinine, and maybe after quinine works, the person is fine, but there's some neurological defects that take place. Maybe they become deaf or blind and things like that. So you can only restore up to a certain level. So what essentially can be done is, obviously, they can have some homes that they can stay in and have food, because them being out there on the streets, they're prone to harm and danger and abuse. So that should never happen to any human being. So some of them, yes, can be restored in one way or the other through a lot of intensive treatment, which it requires residential care and so on, and possibly community rehabilitation by being able to get into a home that works. And some of them, maybe you can only manage to give them some good care.
That was Dr. Akani. There are not just 1, 2, or 3 mental illnesses. There are too many to mention in this podcast. This means that we cannot box everyone with a mental illness into one category. We need to be aware of the different types of illnesses and their causes. One thing that struck a chord with me was Dr. Akani mentioning that sound mental health is critical to the way someone functions, because if something is wrong, it can affect a whole lot of other things. Just as we take care of our bodies, we should also take care of our mental health. Remember that mental health is everyone's responsibility. We cannot assume that we can never be affected by any mental health challenges. On the other hand, lack of comprehensive national statistics on mental illnesses implies that we cannot fully grasp the gravity of the issue, and as a result, it becomes difficult to put in place preventative measures and treatment centers. The sound design of this podcast is courtesy of Zasplat. You can get in touch with me at www.peternower.com. My Facebook page is Peter W. Nower, and my Twitter handle is @PeterNower. I would like to hear your thoughts and opinions on what has been discussed in this podcast. Please remember to rate, review, subscribe, and share this podcast. I have been your host, Peter Nower, and you have been listening to Silence Interrupted.